In this video, we're going to see how the new disposable tips for the Picasso light can be used for crown troughing. You can see the two fibers. The disposable tips are on the right hand side, and here's a fiber optic cable with a blue cover cap. The tips come in 90 degrees on the right, 45 on the left, and varying lengths. The Picasso light unit is seen here with the tips and the fiber, which is plugged into the back of the unit, as you can see. The tips are removed and pre-sterilized from the package. The blue cover cap is removed and the tip is simply placed onto the top of the unit. In this case, we had some buccal restorations where gingivectomy was done and some amalgam restorations and occlusal decay which were replaced. There was an occlusal restoration very deep on the second molar, a fractured first molar which had a full crown preparation. You can see the amalgam restoration removed. Cracks on the distal marginal ridge were observed, and here are the restorations on the buccal completed of the premolars and canine. You can see the gingivectomy done there. Etch was placed. You can see the isolite, core buildup and resin restorations, and the crown prep completed here for lava crown. At this point, we're thinking about using the laser. The fiber was picked. The tips were 10 millimeters in length. You can see it's pre-cleaved here and ready to be initiated. Here's a video, and you can see that we use 1.8 watts pulsed with a 90-degree tip of 10 millimeters in length. They come in 5 and 10 and 15 millimeters in length. We start initiating the tip and we start crown troughing, going very slightly into the sulcus, moving very slow with brush-like strokes to gently remove the gingival sulcus. Every time that a little bit of debris piles up on the tip, you stop and use a wet gauze, not alcohol, but just a wet gauze, to remove the debris that gathers onto the tip. Short brush-like strokes. You're not trying to go deep into the sulcus, just half a millimeter or so. If you notice the angulation of the tip is always at about 60 degrees to the margin. You can see, in fact, in the distal that perhaps I had not created enough space for the diode, which is a 400 micron tip, to get in between to really create a nice sulcus there. If you notice a little bit of charring, you should lower your energy settings. In this case, you can see that there's not a lot of charring occurring. We're progressively moving circumferentially around the tooth, again constantly angling towards the tooth, and every time that a small amount of debris picks up on the tip, we stop and remove it with the wet gauze. We're now on the facial aspect of the tooth, and again looking through the operating microscope at around 5.3 times magnification. Now, as we come to the mesial in a second, the last little bit of the mesial, you'll see me bump up the magnification here to 8 times magnification to complete the troughing. What I'm looking for are small areas where perhaps the tissue is still on the margin, like on the distal here, where I just want to remove that tissue so that the impression is picked up clearly by the polyvinyl siloxane impression material. Moving now to the mesial. Again, I'm doing short brush strokes to create a separation of the tissue from the margin so the lab can clearly discern where the margin ends and where the tissue begins. At times you'll see tissue tags which can be removed with short direct brush strokes to remove these tissue tags, and eventually either using hydrogen peroxide in an ultra-dense syringe or a wet cotton pellet to remove any tissue that has been sloughed off and is white in appearance. At this point, the troughing took about 3 minutes. You can see there's no bleeding. The tissue appears healthy in color, and we're getting close to a point where we can take an impression. If you feel that lateral distension is needed, you can use materials like X-Bacil or Traxident to accomplish this task. You'll now be able to see the stills of the final procedures, both at low and high mag, before the impression was taken. Here's a clear view after the impression was taken, and finally with the provisional in place. This is Dr. Glenn Van Ass saying goodbye and keep lasing. It's amazing.